Hello, and welcome to the second episode of Mindful Conversations, where we create a safe space to explore mental health, personal growth, and emotional well being. My name is Lisa Ford. I'm a clinical therapist, an entrepreneur, and the owner of Harmony Wellness Counseling and Consulting Center, located in Laurel, Maryland. Today, I have here with me today my colleague, Erica Coleman. Introduce yourself, Erica.
Hello, everyone. Thank you for joining us today. Again, my name is Erica Coleman. I am the owner and certified psychiatric rehabilitation practitioner of Embracing Tranquility Behavioral Healthcare, also located here in Laurel, Maryland.
Well, today's episode is going to be special. We were able to explore the ongoing mental health impact of long COVID. While much of the media coverage has moved on, many individuals that we see every day, especially those in vulnerable communities, are still grappling with the emotional and psychological fallout of the pandemic. In this pre-recorded interview, I had the opportunity to sit down with two seasoned mental health professionals, Kofi Dofour, a doctor of nursing practice, and Jason Eliassaint, a psychiatric nurse practitioner, both of whom serve patients in the Laurel and Silver Springs community. We discussed collective trauma, the long-term effects of COVID on the different age groups, and what they're seeing in their frontline practices of care. Also, many times we see the same thing.
Right.
So let's go ahead and listen in. Introduce yourself, guys.
Hi, so I'm Kofi Dofour. I'm a doctor of nurse practice and in mental health. So I see patients on the outpatient basis, primarily helping them with medication management. I have like individual clients, but also work for Blue Sky Mental Health, where I see patients on an outpatient basis.
Right. Well, my name is Jason Eliassaint. I am a psychiatric nurse practitioner. I have been practiced for, I would say, over 10 years in the field. Currently, I am a co-partner at Blue Sky Mental Health Clinic. We currently have a clinic in Silver Spring, Maryland, and one in Laurel, Maryland.
Okay, well, thank you guys. And actually, their office is next to the office where I'm at in Laurel. So I wanted to bring them here today because they are actually members of the Laurel community. So today, I just want to talk about COVID. But first, I want to ask you guys, like, what does collective trauma mean? And when we think about COVID, how does collective trauma impact, or how has it impacted COVID?
Okay.
Well, I would say to me, collective trauma means when a group of person or community going or went through a traumatic experience. But in terms of COVID did not just, affects one community, it affects the entire world. Like I said, all of us were, suffered from COVID. If we didn't suffer, we know somebody or family members or neighbors who suffered from COVID. So when it's come to COVID, it's not only one community, it's the entire world that's, affected by this.
Kofi, any thoughts about collective trauma?
In terms of the collective trauma, maybe picking it back, seeing it as what happened with COVID is one of the few things that, outside, I guess, maybe the polio outbreak from the past, is something that most of us have never experienced to this magnitude, to this level, where it was global, but it was also very local, meaning getting access to the things we were used to, that completely changed. You'd be hard pressed to find someone who wasn't touched or impacted by COVID, regardless of what industry that they are in or age group, that they weren't impacted in one way or another by this COVID pandemic. The entire world sort of came to a standstill, and really it was an overarching thing of fear. Fear was the predominant emotion that was hovering over everyone, from whether you're a business owner, financial institution, you're worried about, hey, what's going to happen in the future? And for us in healthcare, people are afraid of contracting this diabolical disease, because we saw it all on through media, where people working in the hospital or first line workers were in danger of contracting the disease, bringing it home. So it was on a whole nother scale because it was affecting the entire globe. And because we now live in a time period where media conveys information all over the world in a matter of seconds. So we're seeing things like CNN, MSNBC doing death tallies, right? It's like almost election night on CNN with Will Blitzer, where they're counting up the death toll. So there's no way you could not have been impacted by this, because you're looking at these hundreds of thousands of people that are reported to have died from this this disease, and you're wondering, hey, is it going to come to my door? And am I ever going to, resume life without having this fear that I'm going to be the next one to also pass away? So it was on a completely different level, completely different scale. And maybe the baby boomers who might have experienced something with polio could identify with this, but I know for us, it was something completely new.
Yeah, I agree. I was going to mention, particularly you guys that are healthcare workers. I just remember nurses were staying in hotels. They're afraid to go home. I remember, looking at and listening to the governor in Maryland, just counting the number of people that were affected, the number of people that died. So collectively, it was a traumatic experience for all of us, whether you were in the healthcare industry, whether you're at home, you were just really worried about how this was going to affect you, your family, your kids. So thank you. I think that that's a great insight that you just provided, because I think that our audience would like to know, like, they probably were there too, And so, like, the next question I have for you both is, like, what are some of the long-term effects that you see in your patients, like especially kids, young adults, and even seniors and other vulnerable populations? What are some effects do you see?
What I see during the patient, I see patients, from the age of 9 and up. It's like Kofi said, it's affected at any all ages. Most patients, especially the younger adults, or even people who are in grade school, they miss a lot of schools. I mean, they could not be around their friends on campus. They have, just do virtual learning, which was difficult for some people. That led to isolations, that led to, can lead to depression, anxiety, and so much more. So this is one thing I've seen in that populations, but with the adults populations, or I would say the adults or even the elderly, they're afraid, especially those who are living in a nursing home, and, they all fear, of dying. Are they next? Am I next? Is if my neighbor's next? So therefore, it is, like you guys said earlier, it's affected anybody in any age group, and it's still lingering around. Still seeing patients, saying, "I'm afraid something like that might come back again. I'm afraid, I'm afraid, I might not be able to make it, or if I catch it again." Even there is, medications out there, injections for once, you can take once a year. You still can get COVID even with the injection. But if you receive the injection, it will when the symptom would not be as harsh if you did not get the injection.
Wow. Kofi, do you have anything to add?
Yeah, the different age groups. So yeah, for the school age kids, yeah, I think there was more incidents of seeing like delays as far as developmental delays, even though it wasn't, you might say it wasn't a great time span, but yeah, being at home for that period of time and not actually being in person for classes, it did affect children negatively. But what I saw was like the children being delayed as far as even with speech, because they were used to being in person or interacting with their peers. Now you isolate them, and they're in silos, so the interaction was lacking. So I saw some increase in delays, but also like for the age group, the young adults, so to speak, a lot of people now, because they were in these silos, they had a lot of exacerbation of symptoms or recognition of symptoms that they might not have noticed otherwise. But being, it's almost like when people go to jail and then they're forced to deal with themselves
Yeah.
and figure out what they have going on. So a lot of people, and I don't know if it's, making it up, because some people will come and say, I have this, I have that, I have that. And you get to the bottom of it, it really is not so, you know. So a lot of people were creating their own diagnoses, or maybe recognizing certain things that they might not have otherwise noticed. But the truth is, though, what I do see now is it's not so much the physical effects of it. It's been a financial impact that people have had because of COVID that is leading to some of these mental, because it's stressing out about their finances. So it's leading to more anxiety and more depression because they really don't have answers. I mean, there are people that are really suicidal because they're like, hey, I'm on disability and it's been cut off. I don't know what to do, So I've been seeing more incidents of that with the people my age group, not even like the elderly who we would think would be more dependent on social services for their livelihoods. It's been people who should be of working age, young adults, and the jobs post-COVID, people not talking about the jobs, some of it have dried up, For healthcare is different because yes, we've seen actually an increase in people trying to access healthcare because telehealth really had a boom because of COVID. But now that they're trying to, get America back to work, as they say, we're seeing that the lack of access is coming back again, because what great thing that happened during COVID was, we have public health, which is treated as a completely different sector than us that actually are providing the care in real time, right? And the two systems rarely communicated with each other. But when COVID occurred, we were forced to share information, forced to break down those walls and communicate with each other. Because oftentimes what happens in public health, it takes a few years before it trickles to us that are in practice, but we also relay information back to them so they can create these policies that we all have to follow, so to speak. Yeah, but what we saw that we eliminated the barriers because we needed to, emergency petitions, things that needed to be put into place so that the nation could just function. Well, once there was some alleviation of that pressure, we went back to doing business as usual, which was the issue because it creates problems that are not addressed. So older adults not comfortable with coming out and expressing that, hey, I have depression because I can't pay my bills this month. They're less likely to talk to other individuals about it. So there are people that have needs, but they're not coming out to express themselves. So it's like we're going back into our silos again. And we're talking about long COVID, but we also have to recognize at the beginning of this year, we had a new administration that began. And with the new administration, regardless of what it was going to be, there's going to be change. There's going to be change in policy, unless the Biden administration continue. But with a new administration, things are going to change. And even with that, I've seen an influx of individuals saying, hey, I want to get out of this country. I lost my job. Me and my spouse have lost our jobs. So it's almost like a revisitation of this, almost like what happened in COVID, where it's on a mass level that people are being impacted, and it's really connected to their livelihood, and that's driving symptoms of anxiety and depression, which otherwise would not have needed any treatment. Now it's at a level that I need some treatment. That's kind of what I'm seeing with the young adult population. Let's say like from 18 to like maybe 40 years. Yeah.
Well, I don't see children anymore, but I remember when what was it, March 13th of 2020. And I remember, working for an agency in private practice, and we were trying to figure out how we're going to do telehealth. We hadn't done it before. And then, like you said, a lot of the policies from the Maryland Department of Behavioral Health came out and said, you can do telehealth. And there were people who needed like social skills, like our PRP programs, psychiatric rehabilitation programs.
Mhm.
They didn't want to fund those until it was like, okay, a week or so later, they came back and said you can do those things for telehealth as well. So I just remember just the, meeting with teachers who, they were on leave too. But then the parents that I was meeting with were now complaining because they had to be with their kids all day. And it was hard because it was like the same behaviors that the teachers were complaining about. And they were like, the teachers aren't doing their job. Now the parents had to deal with those same behaviors and challenges on top of them not being able to socialize, go outside, be with their friends. So we talked about collective trauma. And like you're saying, both of you, we're still dealing with it to this day. I have clients that won't go to the grocery store. They don't want to be in crowds. There's a lot of anxiety. And then now we're talking about financial issues. I mean, Maryland, DC, and Virginia, the job loss is outrageous in our community because most people in Maryland, DC, and Virginia, they work for the government. So now we're now still dealing with some of those lasting effects. So thank you. I think that was very insightful from both of you.
Yeah.
So, when we think about long COVID, and you talked a lot about how it affects on their physical and mental health. Any other thoughts that are coming to mind from you guys just based on your experience with your patients?
Like I said, most of my patients are still fear. They, still fear something, similar to COVID might happen. So it's definitely, impact them in different ways, not only mental health, but physical health. But like Kofi said, they also suffered a lot of financial setback. They are still dealing with this till present.
Mm-hmm.
A lot of people lost jobs, or they couldn't work properly, or they could not, not every job can be done virtually. So some people, I know a couple of folks who lost their housing because they couldn't work during that time. So it's still affecting people, even though it's kind of over, but it's not really over. People still getting COVID. It's not, you don't hear about it as much because most people receive the COVID injection once a year. The symptoms decrease or diminish, but COVID is still around. We just don't hear much about COVID anymore.
Yeah. Any thoughts, Kofi?
The only thing I'll reiterate again is that I think there was this influx of like telehealth, right? And I think for some people they hit the wall with that because when dealing with patients and you asking them, hey, are you in therapy? And a lot of them come back with this response of, yes, I've been in therapy, like as if it's not something that is effective
Mm-hmm.
and can get them on the other side of their symptoms. So I think people have been even fatigued with that because while they're in therapy, are they really engaging, right? Or is it just something they check off, right? It's like, okay, I got my therapy session today, I got to attend, but are they really going back the things that are shared in therapy, the homework that is given, are they really engaging in it? No, I think that's what I'm kind of seeing is that because it was such a huge influx in such a short period of time, I think people were over inundated, right? And some people were not ready, as a practitioner, if you see someone and you're like, hey, man, you need to be talking to somebody every week because of what you got going on. But on the other side of it, they might not get that. Or they might have said, I was with a therapist, I didn't get anything out of it, And so that's kind of more what I'm seeing. There's almost this fatigue of treatment, but yet people still have needs. So that's kind of what I'm seeing is it's a little bit it's difficult to navigate that area because if a person has had a negative experience, it's hard to tell them, hey, well, maybe it was negative because you didn't really engage, because then that'll be another reason for them to say, hey, I'm offended because you're not hearing me.
Mm-hmm.
But I think that's kind of what I'm seeing with this. It was this rapid shift from in-person to telehealth format, and I think with that, a lot has been lost. Because having to make an appointment, having to get in your car or take transportation to go to an appointment, you're more engaged.
Yeah.
Where you just sit home, click on a button. I could be telling you, hey, this is what we're gonna do this week, and then you come back the next week, or even may not even come back, miss an appointment, and then we're starting back to square zero, and then you're saying this is not effective. But nah, it's like really didn't engage. And sometimes telehealth can make it too convenient for those that need the help to not engage in the help they need. That's kind of what I'm seeing.
What an insightful, grounded conversation. What stood out most to me was Kofi's point about therapy fatigue. What they're seeing and how we see many people starting using teletherapy during the pandemic, but as we see now, they're disengaged. Not because they no longer are supported or need the support, but because they're emotionally exhausted. I wonder if many of our clients are seeing that or experiencing that. Are you seeing that, Erica?
Yes, Lisa, I've been seeing that a lot in my practice as well. We prefer to be in person.
I would also put in there, like during COVID, since a lot of people was working from home, this is a lot of people, this is when they found out they have attention deficit disorder, which is ADHD, because they were working from home. Now they aren't able to sit still in a place, and they don't have, supervisors around. So ADHD also, as you know, there was a shortage of ADHD medication during COVID, and still a shortage of ADHD medication during right now. And most of it is, people found out they have ADHD during the COVID epidemic. So this, I believe, it's still impacting them different ways. ADHD, now a lot of them has to be on medication for it. This is, one reason we have a shortage.
Yeah, that's good.
Yeah, I agree. I think too, just to piggyback off of what you guys were saying, that, it is different as a clinician working with patients that are on the video. Some, even with kids, many of the kids may have a hard time with engagement, because I remember having sessions where the kid was playing a video game, right? And then also I do recall too, like sometimes it's when you look at me and I look at you guys, I know you both personally, but you don't know if I'm on a cane. You don't know if I have a hip problem. You don't know if my house is clean or if there's other things. So I think what happens is you miss those clinical impressions because you don't necessarily have a person in front of you. So just like engagement is important for us, it's also important for our clients and our patients, right? They want to know who is Lisa, who is Kofi, who is Jason, and seeing you sitting in your office, they get a little bit of a better, a relationship or engagement with you. Now, I'm not saying that the virtual appointments are not beneficial, because it creates access when many people don't have access. But I also think that sometimes it's a barrier, and but we're going to still do it. I think that it's helping many people get access to therapy, and even with you guys, medication and medication management that may not have, because of transportation, because of their jobs, they may not come. So I guess my last question is, what would you say to someone who's struggling to find the new normal because of long COVID and the implications and the impact? Like, what would you tell people who are still struggling with like the new normal? Right now, everything is virtual, right? We talked about that. People are deciding whether they want to take the vaccine or not. It's not required anymore. You also talked about just, the new administration and changes that are coming down relative to that. So like people aren't able to pay their bills. There's a lot of stress. So how do we, what would you say to our audience about the new normal and people that are still struggling?
I would say, help is out there. Please seek help. If you are suffering mentally or, please seek help physically, please get help. I know a lot of things have changed since COVID, like we are discussing earlier, telehealth, virtual appointments. I know personally, I like, in person is better. Like Lisa said, I can go ahead, I can evaluate the patients. I can see, if the limbs are moving, if this, am I missing something? Even though I can ask the patient the question during the evaluation, but seeing it will be much better. I can know if it's the right leg or the left leg or which
Mhm.
extremity it is, or what's not moving or what we need to do to get the patient that the help they need. So I would say, help is out there, even virtually or in person. Please, please go out there and get help. And things might not get back to the way it was before COVID, but trying to live your arm as normal as possible.
Okay. Yeah, what I would say is for individuals to really engage in their support systems, right? Because I know there's a push from our healthcare systems all over this nation to really get to the upstream, where we're using upstream investments where it's really preventative care. We want to get ahead of things instead of chasing chasing things where they call like the sick model, right? I mean, for us in our situation, we're as outpatient mental health, that's what we're dealing with. We're dealing with individuals that have already, unfortunately, prevention didn't work, right? But there are things in place to prevent somebody getting to a state that they need crisis or intervention. And one of the things that they're looking at nationwide in the different systems from state to state is making investments into healthcare systems that allow individuals to engage in things that they can do on a daily basis um, to prevent getting to the point that you need treatment, right? So, yes, get your annual checkups and all of that, but also engage with your support system.
Mhm.
Well, people leave that out. And if there isn't a support system, that's where we realize there's an issue. So what I would tell people, yes, engage with your support system. If you don't have one, then you have to reach out for help so we can try to create one for you. But if you have friends, family members, coworkers, or people that you know that you can rely on to bounce things off of, if you know of community resources that can help you to stay financially afloat, continue to engage in those things. And the lifestyle where I know it's difficult to convey because especially now post-COVID, it seems like everyone is more hostile. Everyone is more short-tempered.
Yeah.
Like, yeah, it's a very hostile environment we're living in.
Mhm.
So there's almost everybody's on edge. There's this unspoken thing that we're living in now that everyone is on edge. From the things that we witnessed through media, from a lot of things have occurred post-COVID with the George Floyd protests, the insurrection, this re-election,
Immigration issues now.
and now what we see. So there's a lot going on that is anxiety provoking. So people have to realize that, hey, you have to know don't engage in some of the things that you're seeing here because it's going to make things worse. Try to draw back, engage in your local support systems, engage with the people that you know are therapeutic that can help you to not get caught up in what's going on out here because there's a lot that's going on out here. Eating, right? There's this thing, food is medicine, right? Eating. I talk to some of my patients and they'll be so surprised that, hey, eating blueberries, getting vitamin D3, going for walks, when it's not wintertime. There's other things that you can do to keep yourself balanced, that if you need a resource, we can give them to you, but we want you to engage with those that are you can reach them, you can touch them and be actual in communication and engagement with them, because too oftentimes people are waiting for an appointment. People are waiting, but no, you don't have to do that. Find somebody that you should have someone in your life that you can engage in real time on a daily basis to help bounce things off of and keep you in check. And if you don't have that,
natural supports.
You say what?
Natural supports.
Yes. Yeah. Let's try to, engage in some, but things that you can get to readily, you can easily and readily get to, and things like your diet. Yes, definitely. There's a financial component to that, but if you can change your diet, and I try to tell omega-3, vitamin D3, if you can't, but anything, foods that are high antioxidants, you'll see a difference over time. So yeah, just engaging your support systems and the things that you can get to on a regular basis, instead of waiting for that appointment.
I think you told me, and I love it, but no microwave popcorn.
Oh yeah. Because that people don't understand, like food, it affects your mood. When you put these chemicals into your system, yeah, you can go off and then you're thinking, if you already have an underlying condition like depression, anxiety.
Yeah.
Well, if you got anxiety, you definitely don't want to be eating all that sugar.
Yeah.
Once that sugar goes down, yeah. So it's just certain things like be mindful with what you're working with already, and then what you're ingesting is going to have an immediate impact.
Okay. Well, I appreciate you guys' time today. And I see Jason's probably busy seeing patients, right? We're stopping to do this in the middle of our patient loads. So before we go, tell people where they can find you, how they can reach you guys. I'll have that information on the at the end of the show, but if you want to give a word of where they can find you, how to reach you guys.
Oh yeah, awesome. Yeah, definitely. You can find me on Psychology Today, but our office is located, there's 2 locations. I'm at the Laurel office. You can call us at 240-377-0260. We're located in Laurel, Maryland, off of Greenview Drive. There's another location in Silver Spring, Maryland, really Wheaton, Maryland, right off of Georgia Avenue. And the practice is called Blue Sky Mental Health Clinic. Silver Spring, you can reach them at 240-865-3135. Yeah.
Well, thank you both for your time today. And once again, I appreciate it. And, I really enjoy working with you both.
I think Jason's reminder that help is still out there is so important. Even though we're no longer in a crisis mode, the lingering stress, financial hardship, and anxiety are very real to so many people, especially our young adults and our seniors. This idea of the new normal isn't an easy space to navigate alone.
Right. And it's not just about therapy. It's about rebuilding community, as they mentioned in the video, strengthening natural support systems, and in some cases, just helping people remember how to ask for help again.
And if you're listening, struggling with any of this, just know that you're not alone. At the end of the segment, we'll provide resources, including of how to reach out to Kofi, Jason, and if you would like to connect with any other mental health provider, including myself and Lisa. As we wrap up today's conversation, we invite you to take a deep breath, hold space for the complex emotions at this time of uncertainty. The world is shifting again, especially now with the U.S. entering into another conflict. Many of us are carrying invisible burdens of worry, fear, anger, and even sadness. Some of us even have a sense of deja vu from our past collective traumas. Acknowledge your emotional responses. They are valid. Whether you're a veteran, a survivor of post-wars, an activist, or even just someone trying to make sense of it all. This is your moment to slow down, reconnect with yourself, and allow yourself this time to feel. Thank you for joining this episode of Mindful Conversations. Remember, healing is a journey. Every step that you take, it matters. Be kind to your mind, listen to your body, and give yourself permission to heal.